I'm from Jeddah King Fahd Armed Forces Hospital, and yeah, that's good. We work in a system, those in Saudi Arabia know that if we have two systems, public and private. In the private, which is insurance-based, if a patient is labeled as three-vessel disease, the insurance will never allow for intervention, regardless of how easy or simple it is, and they will be forced for bypass surgery. And so we get a lot of people labeled as three-vessel disease. If they can escape and they come to us for second opinion. So this was a very elderly symptomatic lady. She did not have any acute coronary syndrome. She just had very limiting angina, limiting her from her life. Her ejection fraction was normal, and it's very rare for me to see hemoglobin A1C of 5.6%. I'm used to seeing hemoglobin A1C of 10 and 14. Her LDL was very good. So I'm going to go over her angio. So this is not something we just did ad hoc. We actually had her see our surgeons as well. She had a low syntax score of 22, and both options were presented to her and her family. And the patient absolutely refuses surgery. And this is her angiogram. So you can see why the other hospital did not want to do it. It's essentially an ostial LAD. A severe proximal circumflex, so she was labeled as left main equivalent, and a long LAD. In addition, there's a long right coronary artery. So after discussion with the family, and after they turned down surgery, we went ahead. This was her syntax score, essentially equal compared to Taxus, and we know Taxus now is not a very good, was not a good stent. And her syntax 2 score, basically, we discussed this with the family, and they did not want to, she did not want to have anything to do with surgery, essentially. So this was, I just put the pictures of IVUS to show that all the three vessels were done with intravascular ultrasound guidance. So the first vessel I fixed was the circumflex. I had, by IVUS, a very nice ostium at the circumflex. I did not have to go into the left main on the circumflex side. So this was treated with a 2.5 by 23 dynamics, IVUS guided. So our patients have small vessels. And this is something we keep learning every time. And then this was a long dynamics, I'll show you, in the proximal LAD. So a 2.5 by 32 dynamics in the LAD, and a 3.022 stent proximally into the left main from the proximal LAD and post-dilated to 3.5. This was the actual sizes by intravascular ultrasound. We did not use the dynamics in the ostial LAD into the left main because we are part of a registry that we cannot put the dynamics in the left main for now. So that's how we did that. So this is 3 stents here, and then we brought the patient back for the right coronary artery. So it wasn't done in the same session. We brought her back, and she got 3 dynamics. So here we go. Does this work? Anyway, so a 32 here, another 32 here, and a 14 proximally. So this was, again, intravascular ultrasound guided procedure, and this was the final result. So all 3 vessels were fixed. The lesions themselves were not difficult to do. It was just simple balloon device, IVUS balloon device. So, but it shows you that multiple long stents were placed in relatively small vessels, and I hardly ever see very large vessels in our patients. Our patients have really bad disease and small caliber vessels. Thank you.